keep this very informal and ask any questions as we go through today. So my thought was to talk to you a little bit about healthcare access and chronic disease and share with you some of the insights that we're learning from our current and ongoing cattle feed yard worker health study. So, you may be wondering, what is a feed yard? And how does that play into agriculture? So I'm going to start today by talking about the beef industry. So I wanted to give you just a glimpse of, what a feed yard looks like and to kick us off right now. So here's a bunch of cows. This is what a feed yard looks like. So if you were working on a feed yard, this would be your view every day. So the beef industry itself is a little bit different than the pork industry or than the poultry industry in that it is not as vertically integrated as those other proteins are. So the beef industry is pretty diverse. So you have people who are called seed stockers. Seed stockers you can think of as being the folks who supply the genetics for the livestock. So that may be providing semen, it may be providing replacement heifers, or those sorts of animals or those sorts of products into the industry. Those will result in cow-calf operations because, we're trying to produce more cattle. So we need to have those seed stockers. Obviously, there needs to be some calves and some babies to continue to produce the meat. So there are cow-calf operations. These are what we typically think of when we see ranches and the picturesque, rolling hills and the free cattle that are roaming around on pasture. That's what I think of cow-calf operations. After there is a calf, they will oftentimes be sent to a stalker or a backgrounder, which is an opportunity for them to continue to be on pasture and to gain a little weight before they transition into a feed yard setting. Or directly from the cow-calf operation, they can go into the feed yard setting itself. I'll tell you all about feed yards here in a minute. But feed yards, from the feed yard, they then go into meat packing plants. They go to the retail store where you're able to buy your beef, and eventually that is the consumers. So cattle production is the most important agricultural industry in the United States, and it consistently accounts for the largest share of cash receipts for any type of agricultural commodities. And in 2024, cattle production represented about 22% of the total $515 billion in cash receipts for ag commodities. So about $113 billion in cash receipts that are just related to cattle production. This produces over $1 trillion of economic impact. So when we talk about the beef industry, we are really talking about a very large and very powerful industry that employs a lot of people and has a huge impact on the United States as a country. So cattle production, as I told you, is a little bit different than hogs or than poultry, but there has still been a shift to larger and more specialized farms just in general. And there is a little bit more local ownership in terms of the beef industry as compared to hogs or poultry, and there is a little bit less integration. So it is unique in that respect. So here you get the overall picture of what the beef industry looks like. So we are concentrated, our study is concentrated there on that bottom block on the feed yard. So this next picture is a picture of what a feed yard looks like. And so oftentimes people ask me, well, what is a feed yard? So the feed yard is that final stage of cattle production. So typically when the cattle get to the feed yard, they spend about 3 to 6 months here in this place. At the feed yard, they concentrate on trying to increase the gain of those cattle so that they're putting on weight very efficiently. So typically they're shooting for 2 to 4 pounds of gain per day per animal. And so they're feeding these animals a ration of different grains and supplements and minerals and so forth, to be able to really maximize that efficiency in terms of those gains. So I've had to learn a lot about the cattle feeding industry because you really need to understand context when you're talking with farm workers or you're talking with um, agricultural industry stakeholders. You need to know what they're doing. And so I've spent a lot of time trying to learn the business side so that I can have those types of conversations with folks. So the United States has the world's largest fed cattle industry. We're also the world's largest consumer of beef, and that's primarily what we would consider that high value or the grain-fed beef. So cattle production, you can see in the little map here, is really concentrated in the Midwestern part of the United States. If we had to go through the USDA, they put together a cattle on feed report that comes out every month. And you can see that the top 5 cattle feeding states, Nebraska is #1 right now for the number of cattle on feed, followed by Texas, Kansas, Colorado is 4th, and Iowa is 5th. Now, Nebraska and Kansas, we kind of go head to head in terms of who's #1 or who's #2, but currently, right now, we're #1. So we have more cattle on feed than the state of Texas. So a couple of years ago, our team looked at some of the state and regional and national data about ag and specifically about animal production, workers, and operations using data that was publicly available from the Bureau of Labor Statistics. And what we found is that our Central States region, so as you heard from my bio, I'm with the Central State Center for Agricultural Safety and Health, so our 7-state region, had about 50% of the total number of cattle feed yards in the country and about 50% of the total number of employees in the United States. So this equates to about 600 feed yards in our region and about 7,600 feed yard workers. So in our analysis, one of the things that we wanted to look at was the number of injuries that had occurred. And we did definitely find that in animal production, as you might expect, that there were a high number of fatal injuries and a higher rate of non-fatal injuries than just the average within agriculture as an industry itself. We found that about 30% of all of the animal production fatalities in the country happened within our Central States region. And as I mentioned, we do have a high rate of non-fatal occupational injury as well. So 1 in 4 jobs in my state are related to agriculture. This is pretty incredible. So we think of Nebraska as being the golden triangle because there is such a synergy between the production of corn, the production of livestock, and the production of ethanol. And there's just a lot that goes on. And so we're able to use corn byproducts in livestock feed. We're able to use ethanol byproducts in livestock feed. And so there's a lot of synergies there. We are ranked #1 in the country for commercial cattle slaughter. We're ranked #1 for the number of cattle on feed. We're ranked #1 in the country for beef exports. #2 for cattle and calves. #2 for commercial red meat production, ethanol production, popcorn production. You can see where there is all of these synergies here that I'm talking about. So when I talk about the beef industry in Nebraska, or within the Central States region, you can see that this is really a vital industry for our area, for our region. So I often get asked, well, who are feed yard workers? And I think a lot of people are still in the mindset that these are family operations and that, it's a father, a son, or maybe a grandfather, and it's sort of this generational operation. But feed yards, as I mentioned, are getting larger. And what we've found is about half of the workforce consists of Latino immigrants, and mainly people who are coming from Mexico. And we've also seen a number of workers who are coming from South Africa, but I would say the majority of the workforce is people who are foreign-born individuals. So there is, I think, a lot of opportunity to change people's minds and change their perspectives on who are the folks that are producing the beef here in our country. So today I said I wanted to talk about chronic health conditions. And so chronic conditions are some of the leading causes of illness and disability and death. And chronic conditions are conditions that last at least a year. They require some ongoing treatment. They can limit daily activities, or they could do both, where you need treatment and you have limited daily activities. So chronic diseases are things that we all know about, like heart disease, like cancer, diabetes. These are some of the leading causes of death and disability in the United States. In fact, these types of chronic conditions are some of the leading drivers of our nation's almost $5 trillion in annual healthcare costs. And about 3 out of every 4 people in the adults in our country have at least one chronic health condition, and over half have 2 or more chronic health conditions. So we're talking about 194 million people with chronic health conditions. So many chronic conditions are preventable. There's a very common risk factors that we can think of: smoking, poor nutrition, lack of physical activity, excessive alcohol use. That's sort of the short list when we think of risk behaviors. And these chronic health conditions are important for us to think about in the occupational health and safety space because they result in absenteeism, so people missing work, the presenteeism, so people being there but not being able to do everything that they need to. So they may be working when they're unhealthy, when they're exhausted, or just otherwise unable to be as productive as they need to be. And this can increase the risk for injury and reduce the overall work capacity of the folks in that particular industry. So if we think about farm workers, there's really been limited research on chronic health conditions among farm workers in the United States. And where there has been published research, it tends to focus on cardiovascular disease and diabetes, and it's mostly on migrant and seasonal farm workers and not with livestock workers. There has been some work that looked at unauthorized Mexican-born farm workers and having a lower incidence of chronic health conditions, or lower prevalence of pain compared to people who are authorized. Some people have looked at the legal status gradient in health, whereby naturalized U.S. citizens report the worst health, followed by legal permanent residents and unauthorized immigrants. So they've talked about that gradient or the healthy immigrant effect. But what we do know is that chronic health conditions are definitely taking a toll, oftentimes a hidden toll on the workforce, on our lives, on our productivity. And there was a survey that was conducted by Harvard and the DeBauman Foundation, and they found that about 3/4 of the people that they talked to with chronic conditions, they needed to actually take time during their workday to be able to manage their chronic conditions. So sometimes that means, you got to take time out to check your blood sugar, or maybe you need to make sure that you're eating at more regular intervals, or things like that. But what they also found is that a majority of people, they don't talk to their employers about these conditions, and they don't disclose that they need any assistance, right? Um, so this is something for us to definitely keep in mind, because if this is in the formal workforce, imagine what it is in the farm workforce, where we have so many other things that contribute to people's fear and reluctance to speak up. So as I mentioned, chronic health conditions, they often result in some physical limitations that people may have. They may need some medical management during the day or have to monitor during the day, and that may require some more flexibility, you could say, in terms of the work organization or the design of work. So just to give you some examples, let's take BMI, body mass index. A higher BMI is linked to a greater chance of experiencing both an initial and recurrent injury. It can also lead to other types of physical limitations, like being able to lift or bend. It may also lead to a higher likelihood of other health conditions like diabetes or hypertension, which can further increase your risk for injury and limit your overall work ability. So that's just an example. So this is something that I think as a field we definitely need to pay more attention to. So we have been working now with feed yards for about the last 12, 13 years. We did a previous study where we did 243 interviews with Latino immigrant cattle feed yard workers, so between 2017 and 2022. And what we found is that most participants rated their health as good, very good, or excellent. You can see that almost 90% reported that. But most also said that they were overweight or obese. Slightly over half reported that they had access to health insurance coverage, and only about 36% reported that they had a regular healthcare provider. So even though people are saying their health is pretty good, there's a lot of factors that make me question as an outsider, well, is that going to be the case over the long term if we don't have regular access to healthcare, if we're reporting already that we're overweight or obese, that maybe we don't have health insurance? I mean, there's a lot of things that make you question, is that going to continue to be the case? Which leads us to the current cattle feed yard worker health study. So the cattle feed yard worker health study is a longitudinal descriptive multiple method study looking to understand more about how stress is associated with physical and psychosocial and social well-being outcomes across time and across industry seasons. So high season where there's a lot more activity versus a low season where maybe it's not as busy as other times during the year. So we say multiple methods because we are using multiple methods, and I'm going to talk to you about those here in a minute. And those include on-site health assessments, self-reported information direct from participants, interviews that we're conducting with workers, ethnographic field work. And the overall goal is really to understand more about health, to understand more about workers' lives, and to figure out what are those interconnections? Where are those leverage points that we have for helping people to stay healthy? So what you can see here in the middle of the slide is a fun. I like to think of it as a funnel. So forgive my drawings, but it's a funnel. So the idea is that everybody who is working at the feed yard operation is invited to participate in a feed yard health fair. So at the Feedyard Health Fair, which is provided free of charge to workers, and there's no charge for the operations to participate either. It is really no cost. We do things like check height, weight, and calculate body mass index. We check blood pressure. We're taking a hair sample to look at cortisol. We are doing point of care measurements for cholesterol, diabetes, A1C. We're looking at kidney, thyroid, and lung function. We're also looking for vitamin D and doing a test for cardiorespiratory fitness using a 3-minute step test. Those are the objective measurements that are taken at the health fair. Then we also can conduct a health history. So we're taking a health history for everybody who comes in to be with us so that we know a little bit about their background. So we're collecting self-reported information on things like smoking and physical activity and alcohol use and so forth. So from the health fair, as I said, everybody who's employed at the feed yard who's over 18 is welcome to participate in the health fair. From there, we're selecting workers for structured interviews with our team, where we go into a lot more depth about the work environment, about their experiences with near misses, with occupational injuries, with stress and different domains of stress, whether that be the family, the economic situation, anything. A lot of different domains there that we look at. And so we're looking for, we've got a sample of 225 for the structured interviews. We have been doing some ethnographic field work with some participants, so we're getting to know them very much in depth about what they do, their lives, their whole situation. And originally, we had anticipated doing a daily diary study to look at stress and how people deal with stress in the work environment. With all of the fluctuation and uncertainty in funding, that's one thing that we put on the back burner. So I won't be able to talk to you about that today. But you can see how we're integrating all of these different multiple methods into our work. So we've got 24 partner feed yards. We have a feed yard partners in Nebraska and Kansas and Colorado. So state number one state for cattle on feed, and number three and number four for cattle on feed. So we've conducted a total of 50 health fairs at feed yards. We've done I forgot to mention on the last slide. So this is a longitudinal study. So the idea is for every partner to allow our team to come on site at 3 different time points. So we've conducted 25 time one health fairs, so a total of 434 participants at time one. We've got 15 time two health fairs and 10 time three health fairs. So we're currently ongoing right now. The health fairs are ongoing. We actually have some health fairs set up for this Friday, next Friday, and we have data collection going on throughout the summer. Right now, as I mentioned, since this is ongoing, we have 592 participants. We have seen participants at multiple times, so we have 936 patient encounters, and we've conducted a total of 321 interviews. That's across time. So 221 at time one, 88 at time two, and then we've done 20 at time three. So we've got a lot of data and information that we're working with.
Can I ask you a quick question about this,
Yeah, of
Athena?
course.
You
Uh-huh.
want to just go back to
Yeah.
your slide. I'm trying to figure out who are repeats. Are these participants repeats for time one, time two, time three? And so you started with 434, and then in time three you have 201. So that means that that number of people came to three sessions or events, or how did that work?
No, though, so we're picking up new people as we go. As you might imagine, there's a lot of turnover in the industry, and so we are not limiting participation to only those who participated in time one. So total number of participants right now is 592. So at time one, official time one health fairs, we had 434, but we're picking up time one participants as we go. Did that
Yeah.
answer your question, Linda?
Yeah. I'm curious about the ability to see people multiple times. You know what I mean?
Yeah, absolutely. We are seeing people multiple times. However, there is a lot of turnover. And as we talk with managers, like the key concern on their mind is workforce and retention. And they just can't keep enough people working. So it is difficult, but we've had many people who've come to all 3 health fairs. So they're longer term employees. We've also been trying to maintain contact with participants throughout the year so that it isn't just a health fair where we show up once a year and you see us maybe, and if you're not there, well, too bad. but we've been sending birthday cards, we send holiday cards. Some of the lab results we can't process on site, like for example, the kidney function, thyroid function, the cortisol test, vitamin D, those are things that have to be processed in the lab. So we're mailing home lab results. So they're hearing from us multiple times. So that's one of the ways that we're trying to engage with them over time. So it isn't just one day we're there and next day we're gone.
I think I had another question also. The
Yeah,
time between time one, how long has this been going on for? How long have you been doing these fairs?
we have been doing data collection since July 2023.
Oh, okay.
Yep.
That's
So
great.
it took me about 2 years to recruit the full cohort of Feedyard partners. So we didn't start time like we were rolling doing data collection. So we have it did take a little bit of time.
It would,
Feed yards aren't well, the cattle industry in general, there's a lot of folks who, they well, they want to see that you really care. And so they're going to test you and see how much effort are you really going to put into this to try to see it through the end. And I think over time they've seen that I'm not going away, that I'm there for the long haul. I care about the industry. I've done my homework. And so now, it's a little bit easier to go back for round two and round three. But you definitely, the first time around, it took a lot of work to try to recruit the feed yards. Once I got the feed yard managers on board, recruiting the workers was quite easy.
are you going to talk a little bit about how you facilitate those relationships with the managers? Is that part of this presentation, or is that something we can maybe talk about at the end? That would be
that
great. Tell
that
us
that
how you
that's a
did it.
presentation at ISASH.
Yeah, great. Many of us will be there. So, okay, great. Thank you.
So today I wasn't planning to talk on that, but I'd definitely be able to answer some questions for you. Maybe we can talk about that at the end. Does that sound okay?
Yeah, great. Thank you.
Okay. So here's some pictures of what a feed yard health fair looks like. So our team has had to be very flexible. Sometimes we get a nice office room, sometimes we get a storage room, sometimes we get a dingy basement, a processing barn, a horse barn. I mean, you name it, a machine shed, the shop. You name it, we've been there. So we come prepared and are flexible to fit into any situation that they give us. We come with our own tables, our chairs, and all of the equipment that we may need to be able to do this health fair. It's funny, some of my team, they have also taken on cleaning roles. Like if we get that dingy basement, they're cleaning tables and dusting and taking care of everything so that when people come to us, it is a nice space for them to be in. So the first part of that health fair is that intake process. So we go through the informed consent process. We talk about what we're doing. We make sure everybody's on board. And then we take that health history. From there, we go on to measure height, weight, and calculate body mass index. Next comes blood pressure. And then we finish it up with blood work for diabetes, cholesterol, and all of the other labs that I mentioned, and the 3-minute step test. So we come with a portable step, which you can see here, which is how we measure cardiorespiratory fitness. And we also do some spirometry. At the end of the health fair, we have, we call it the checkout station, but at that final station, we have somebody who's going through the person's results. So they all get a health report card and they're going through their health report card, talking to them about what all these numbers mean and providing some health education. If we find things that are concerning and need to get people connected into primary care, we also do that. So we come prepared to talk about what are the local healthcare resources, which ones provide services in languages other than Spanish, who take sliding fee scale, and all are all of those types of questions come up. So we are ready to answer those at that final station. However, we encourage people to ask questions all throughout the health fair because that's what our team is there for. And oftentimes we found, especially for the Spanish speaking workers, is they're so happy to have somebody who can communicate in their language. And so they have lots of questions and they're really happy to chat with our team. So let's talk about some of the things that we found or that we are finding. So this is very preliminary data, again, based off uh, part of time one data because we're still doing some data entry as I was putting this all together. So this is part of time one data. But what you can see here is that most people don't have a regular healthcare provider. They're reporting they do not have a consistent source of care. We are seeing that people are reporting a higher rate of smoking. So about 25%, one out of every four people is reporting current smoking, either on every day or some days. Over half are reporting limited physical activity outside of work. And about a third are reporting less than adequate health literacy. We ask about a series of self-reported chronic health conditions. So we ask people, have you ever been told by a healthcare provider that you have XYZ? So we ask about asthma, arthritis, cancer, and so forth, as you can see here on the slide. Um, uh, so based on our preliminary results, we are seeing higher rates of self-reported asthma and high cholesterol compared to national averages, but all of the rest of the self-reported information is lower than the prevalence rates that are reported across the US. But could this be because workers aren't going to the doctors, so they're not going to be included in these statistics? They are not visiting, migrant health centers or federally qualified health centers, especially in our area. That would mean at least a 4-hour drive for many of these people. So that would be also a day off work, which is definitely not going to happen. But you can see what the self-reported conditions are here on that slide. Now, these are the objectively measured chronic health conditions. So coming out of our health fair data itself, we're seeing about 86% of people would be classified as overweight or obese, so having a BMI of greater than or equal to 25. We see about 77% have a higher blood pressure. Now, again, we can't diagnose high blood pressure at the health fair, but we can, see patterns and try to talk to people about making sure that they get into care. We saw about 26% that have high triglycerides, about 20% that have a higher than desirable cholesterol, 15% with a hemoglobin A1C of over 5.7. We do see about 12% with low TSH, which is that thyroid stimulating hormone, and very limited issues on kidney there on the bottom. So, these are some things that I think we definitely need to keep in mind. Blood pressure, I think, is one of those things that um, is for important for us to think about because that creates long-term damage. And so it could be our one measurement in time here, but again, we'll have multiple measurements hopefully as we see people coming back for time two and time three health fairs. And that's definitely something where I think people can make a difference. And having some information about how to control your blood pressure, we found is something that is very much appreciated. The workers really, oftentimes they just don't know. What are some things that they can do? And so having that basic health information available to them at the end of the health fair has been very well received. So overall, based off this first wave of data collection, we're seeing that the chronic health conditions that are prevalent are that overweight and obesity, the high blood pressure, the high cholesterol, and we're finding undiagnosed diabetes out there in the field. And we have higher diabetes rates than what we're seeing in national prevalence estimates, even among farm workers. So we think that there's opportunity here to continue this line of work in terms of chronic health conditions and continuing to monitor those. But we also think that, and from what we've heard from workers, is that there's interest in on-site screenings, like for cancer screenings. Maybe that's skin cancer. We've heard a lot of requests for prostate cancer screenings. People are concerned about musculoskeletal health issues and kidney health. Those are opportunities, I think, as we consider what's the next step for this project is thinking about some of those other types of screenings. The health fair infrastructure itself, I think, has been really beneficial. And we've had some amazing feedback from managers and from workers. I've even had workers who have gone through the health fair and they'll reach out and they'll say, hey, they'll call me and they'll say, hey, Athena, I want to let you know I went to my doctor today and I got on a blood pressure medication. Or, hey, Athena, I have this question. I have a hernia and I need to get into a physical therapist. Can you help me? I had another one who called me, hey, Athena, I can't speak English. Can you help me set up an appointment to follow up on a work-related injury? So, this idea of the health fair infrastructure has been super valuable, but it has also helped to really facilitate trust. So these folks, these workers, our participants, the managers, they know that our team really cares about them. We care about their well-being, and we're there to help them, not just to get our data and get out, but we're really there to listen and to learn from them and be able to develop the services and the resources that are going to be most helpful to them in the long term. So overall, health promotion efforts really need to engage ag employers and ag workers. We've got to do a both and approach, like top down and bottom up, and meet somewhere in the middle. And these on-site screenings is one of the best ways that I've found to be able to do that. As we continue to do these on-site health screenings, I think making sure that we have health education that's focused on prevention and focused on management and emergency preparedness for what happens if something with, a chronic health condition arises, right? How do we take care of these sorts of things? And so by doing these on-site health fairs, we're really reaching a population that is not going in for regular care. So they are not being served by local resources. So we are meeting I think, a very direct and very important need that these farm workers are facing. We found that a lot of the workers talk about structural barriers. They talk about costs. They report that they don't have insurance. Even though insurance may be offered by their employer, they may not take the insurance because that's an extra cost out of their pocket. Language is a big, important issue. Many of the workers that we engage with are Spanish speakers. They do not, or they have limited English proficiency. So making sure that services, resources, materials are available in Spanish is really critical. The workers also talk about issues with transportation and hours of service with local resources if they are available, which makes the diagnosis and the continuity of care and the management of chronic health conditions even more difficult. So what does that mean in a clinical sense? Then basically that conditions, when a farm worker presents, they're often more advanced, they're less controlled, and they're complicated by the work demands and the work design, the schedule, and work organization that this person is engaged with. So these chronic health conditions, they can have a real impact on safety, which is one of the things that we'll be looking into, productivity. They can increase healthcare costs and they can affect employee retention. One of the ways that I sell this health fair idea to employers is this is a win-win for you and for me. You get to take all the credit that you did you're providing a health fair for your employees that you care about them. And it's at no cost to you. So take full advantage of it. So this is a way that workers feel that their employers care about them. And addressing these chronic health conditions in the workplace can hopefully lead to improved productivity, morale, reduced injuries, a lower turnover, better relationships between supervisors and or workers and employers, and hopefully create a more of a proactive safety culture or health and safety culture, we could say. Um, and so some of the things that we've been thinking about, I just had a PhD student who finished pilot testing a virtual chronic disease self-management program with Spanish-speaking workers this spring. So you will hear about that if you're at ISASH. She has a presentation about that, and we'll be able to share more. But yeah, finding ways to virtually support workers might be a really good step, because trying to get workers together outside of the work environment, very difficult. Very, very difficult. So that's one of the promising ways that we're thinking about this, is through virtual means of support. We're also thinking about text messages, and trying to think through some ways that we can be present with workers without physically having to be present. So, with that, I do want to acknowledge that this is the work of a lot of people. We've got a great team. I'm really proud of the team that we've been able to put together. So we are definitely partners with the cattlemen, with Nebraska Cattlemen, with the Migrant Education Program, with Proteus, Legal Aid of Nebraska, and the Nebraska Department of Labor. And then you can see all of our research team here. And this work is funded by NIOSH through through their grant to the Central State Center for Agricultural Safety and Health. And I would be happy to take any more questions that may be out there.
Thank you so, so much, Dr. Ramos. This was absolutely fascinating. I will leave space for anybody to share or ask any more questions. We have about 13 minutes left.
I have so many questions, but I'll also see what I said. So I can ask you some there, but well, a couple of things that you mentioned was just like the way the workers, you facilitate this trust, and these workers were then reaching out with their questions and with their concerns. Um, and I know that once you establishing that trust is critical, and it takes a long time. And once they have that, really become in some ways a lifeline
Mm-hmm.
to navigate so many other things. So how does you and your team kind of manage to do all that with everything else that you're trying to do as well, to make sure that you're responsive to them and being able to help them, and maybe that's part of your team strengths, right? Everyone kind of has a different role.
Yes,
Yeah.
yes, we do. And I've been blessed that I've got great people on our team. A lot of people who love working with people. And I think that's definitely a strength. We've got a diverse team that we put together. So I have folks who are from public health. I also have folks who are from a nursing background, and then I also have some folks from a medical background, who are part of this team. But we try to emphasize when we're on site with people, we care about you. So first thing, everybody has name tags, everybody has smiles. We are all, we talk to people and we ask about, hey, tell me about your family. How long have you been here? We make small talk. But the small talk is really big talk
Yeah.
in creating and establishing those relationships. So we try to do a lot of that. And like I said, we try to maintain that consistent contact with people throughout the year. So they're hearing from us probably at least 4 times a year, if not more. Sometimes when we hear about people having, like one of the guys, he just recently messaged us and said, hey, I have a new baby. So the team, we make a welcome to the baby card, and everybody signs it. And there's just things that take time. But really are very meaningful, and those sorts of things, like when they get their welcome to their new baby card, hey, they're talking to that about with the other workers, I say guys because it is really mainly guys that we're working with. So forgive me for that. But they're sharing that, and so sometimes, when there's a question that comes up, they say, "Hey, why don't you call Athena?" Or why don't you message them? But I've got one, two, three people who typically work the final checkout station who are just really fantastic at connecting the dots. So as they go through health screening, and then let's say one of the nurses says, they have a high A1C, they need to get into a doctor, they need to get seen. They'll emphasize how important it is to get into care. And then at the end, when they come through checkout, again, that team member will emphasize how important it is. And they'll ask them, tell me about how I can help you. Let me give you the name of a clinic or a doctor. I'm going to write it down for you. Do you need my help to call? So they'll try to do as much as they can to facilitate that follow-up care as possible. But you're right, it does take a special skill set and it does take a lot of time. Did that
And then
answer
just
the
one,
question?
yes, yes. And then just one quick follow-up. And I don't know if I missed this, but what is the breakdown between the H-2A and settled workers, and how does that at all inform how you, yeah.
No, H2A isn't really a big program that's used in cattle production. There are some H2A workers, but it's mainly the South Africans. It isn't really Spanish-speaking workers. What we do see a lot of Spanish-speaking workers is on the TN visa. And the TN was a special visa program that was created under NAFTA for Canadian and Mexican professionals. And so to qualify for this particular type of visa, you have to have a 4-year degree in a specialized field that makes it onto the list. So there's a
Mm.
list of like 70 different career fields. So for agriculture, oftentimes what we're seeing are people who are animal breeders, agronomists, veterinarians, and so forth. Those are the people who are using the TN visa. There's a lot of TNs, and this is a program that's growing in the livestock industry. You can go to almost any industry meeting, whether it be pork or dairy or cattle or any industry meeting, and probably there's some attorney who's going to be talking, attorney or recruiter who's going to be talking about the TN program because it has been really a lifeline for a lot of the livestock production industries.
Thank you so much.
Yeah, you're welcome. With the TN program, you are getting people who are very well trained, which is a real benefit. And for the employer, not a lot of strings attached. So basically, you offer the job and that's it.
Are the TN workers working alongside non-TN workers? I mean,
Yes.
there is a question of exploitation of the TN visa, right? That there are workers with very high level skills and they come here, they're recruited here because of those skills, but when they get here, they don't use those skills. They're really line workers. So do you have a sense of that?
Yes, that's definitely one of the criticisms of how the TN program is being used. I see that more in dairy, where people are recruited to do some sort of work and then they end up being milkers, which wasn't what they signed up for. I haven't seen so much of that in the feedlot industry. Usually the agronomists are working on in the feed mill or delivering feed. The folks who are veterinarians are doing some sort of animal care, like being a cowboy or being working in the hospital pen or something like that. So I see much more alignment on the feed yard side.
Got it. Why can't the owners keep workers? What is the problem in this industry?
Yeah, well, it's hard. Workers are generally working about 60 hours a week. So when they are looking to try to bring in, like, let's say local folks or kids who might have grown up in those rural communities to come work at the feed yard, they don't want to work those hours, 10, 12 hours a day. And there's, if the cows get out or something happens, you get called in, you're working weekends, you're not getting that time off. And so that's really, I think, one of the major challenges. Managers will say, well, managers are, yeah, they might say, well, people just don't understand hard work. And so hours and hard work seem to be equated, like they're equal in many people's minds. So I would say that's the major challenge of why they can't keep people. Yeah. So they're missing all the young people who are growing up in the rural communities because they don't want to work that kind of schedule. And when they do get many of these foreign-born workers, they're able to they stick around for a long time because many of the foreign workers, this is their profession. So they've studied veterinary science, for example, so they want to work with animals. They enjoy that. And they've seen that this is a good livelihood for their families, even though maybe from the outside we're looking in on the industry and saying, well, that's really not that much money. But for somebody coming from a different country, to them, the wages seem to be better than what an outsider may perceive. The other big concern with keeping people working is weather. Cattle feed yards are an all-weather operation, so it
Yeah.
doesn't matter if it's 40 below and the wind is blowing, you still got to get out there and check cattle and feed cattle. And that happens a couple of times. I mean, you're checking cattle at least once a day, but they're feeding 2 to 3 times a day. So weather can be very, very challenging, from the extreme heat that we get in Nebraska to the very extreme cold. Yeah, I remember I was calling a feed yard manager because we were coming out, we were scheduled for a health fair on a Monday, and I had been trying to call him the whole week to confirm everything, and I couldn't get through, but the weather was bad. So I was really needing to talk to him because I need to know, is this a go or is this not a go? So finally on Sunday afternoon, I get through. And when he answers the phone, it's literally like 30 something below zero. And he said he's outside chipping away at the water tanks. And so no health fair was the answer, but that was okay. We were able to reschedule. But man, did I feel terrible, because here's this guy answering my phone call at 30 below, and he's outside chipping the water tank so that the water continued to run for the animals.
I'm just keeping an eye on the time. I have a question.
Yeah.
I might shift us in another direction if that's okay.
Yeah.
First, I want to say thank you so much for your presentation. You said a lot of things that really I wanted to follow up on, and it really made me think. And especially in the beginning, one of the things that you said was that people have this image of the small family farm, and it's really shifting towards a consolidation. And like bigger industries are sort of taking a larger part of the agricultural industry. And we're seeing that too, I would say in Illinois, but our main work is with corn, or at least one of the main things that we're seeing. And I'm wondering if you have insights on what that shift means for worker safety. Because we've tossed around, theoretically, maybe that means that the employer would have more funds to keep workers safe, but we've seen it go different ways. And so I'm wondering for you, are you able to detect a difference in what the size of the business means in terms of worker safety?
We haven't looked into that yet, Maggie, but that's something that we're definitely interested in. What I can tell you anecdotally is that many of the larger operations actually have dedicated safety personnel who are responsible for doing training and making sure that there's appropriate PPE and resources that are out there. And sometimes on some of the smaller operations that doesn't all, like, you don't have the dedicated person. It might be the HR manager who is also the accountant, who's also, they wear multiple hats. So that's what I can tell you anecdotally.
That makes sense. And we've also heard that on smaller farms, they have a strong relationship with workers. And so sometimes they're also willing to go above and beyond. And
Yeah,
so we're
that's true
trying to
too.
piece, yeah.
Yeah, that's true too. I mean, it's kind of like a mixed bag. I mean, you've got some really great small employers, you got some really great large employers. And I don't know that I can make one, broad generalization based on the size of the farm.
Hmm.
Mhm. We, a colleague of mine, an anthropologist who works on my team, Dr. Ryan Kotaski, and I wrote a paper about some of the positive deviations from the norm. So we were doing a series of interviews with feed yard managers to talk about what are some of the really cool things that keep people, that create and foster a culture of safety. And so, for example, there's one feed yard where they host a ranch rodeo. So this is their opportunity for all their people. They mainly employ immigrant workers, so they're far from home. This is their chance to bond together, to have a little bit of friendly competition. There's actually a rodeo belt buckle that goes with it, so they get to be the champion. Another feed yard, they have multiple small yards, and they bring everybody to the main office every day for lunch. And lunch is provided by the company. So they cater from some local ladies in town who cook for everybody. But then they use that lunchtime as their time to reconnect, to share safety information, to talk about, whatever things need to be talked about in a more informal way where people feel safe to talk about things rather than having the safety meeting. You know what I mean? And so that's one of the interesting things that we've seen. Another feed yard, this manager, his wife cooked for everybody, and they welcomed everybody to have lunch together every day. That was her job. She cooked for everybody. So like they're creating more of a family, right? And so people feel like they belong, which is a really unique way to look at safety culture, is to create this sense of belonging where there's this trust, and like the relationships are built on trust rather than on hierarchy.
That
Thank
was really fantastic. Thank you so much for this. I have 100 questions, but I'll put them aside. It's very hard for me to control myself, but such interesting work and really informative, and it was just so nice to see this presentation. Thank you.
Well, you're welcome. Thank you all so much for the opportunity to
Thank
be with you,
you.
and hopefully I'll see some of you